Go.
Hi, I'm Bob Schrupp, physical therapist.
Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet.
Well, in our opinion, of course, Bob.
Today, Brad, we just did a video on the top 3 signs that you may have Osgood Schlatter disease or syndrome.
Mm-hmm.
If you do, now you've come here, because we had it at the end of that video, to top 3 treatments for Osgood Schlatter.
Sure.
Now the thing is, you want to remember about this, you're really not able to treat it to the point where you can make it go away.
Right.
This is what is called a self-limiting disease, which means it's going to keep going on until your growth plates fuse. So it's going to keep going as long as you're growing.
Right.
And once it stops, the pain will stop.
Sure. You think I could just interrupt, Bob?
Sure.
Yeah. Well, just so you understand that, is what's happening, your bones are growing rapidly.
Yeah.
And your muscles, and this tape represents your quadricep muscles, which connect to your patella or kneecap, which end up connecting to your tibia. But the bones are growing, and if this is your muscle, it's going and growing and starts to stretch the muscles so that all the stress ends up down there on that knee. So the thing to do is we want to stretch these muscles and strengthen these muscles so that mostly stretch them, we want strength too, but so we can get slack on there, take some of the pressure off that point of injury.
And strengthening is important too, because the muscle's not keeping up with the bone, and it's having to move a larger lever than it did before. So these are the 3 things, and that's good that you explained that, Brad, because you have to understand this why we're doing the treatments that we're doing.
Right, so, and then when you quit growing, well then the muscles will catch up.
Muscles will catch up in strength.
And then you're fine.
Yeah, and then you're fine. So again, we're trying to teach you how to cope with it basically. There's no quick fix, you're just going to outgrow it eventually. So the first thing we suggest is that actually before you do an event, or before you practice, I would actually do some massage on the tendon itself. And I don't see anybody else is recommending this, but I highly recommend it for this reason. And by the way, here's the kneecap, and right below is the tendon. So here's your kneecap, right here is the tendon. And you just take one finger and put it on top of the other and rub across it like this, really hard. And now if you're having pain there, by the way, maybe you don't have Osgood Schlatter. Osgood Schlatter is the pain a little bit below on the bump. This might be more of a tendonitis. But what this will do is this will stretch the tendon prior to competition, prior to you working out, and it'll put just a little bit less stress on the bone then.
Sure.
And it'll also get more blood flow to it.
So you're going to do that for a couple minutes.
A couple minutes.
And your fingers aren't going to get tired,
Yeah.
actually. If you do that, it's very tender and it continues to hurt. It creates a lot of pain. Then you probably want to avoid it.
Yeah.
But after about 30 seconds to a minute, it should start to feel a little bit better, maybe even a little numbish. Then you know you're right on.
Right. So you can go right from that into the second treatment for our second way to manage Osgood Schlatter, which is you are going to have to warm up, and you're going to have to warm up more than any of your classmates or teammates or anything like that. You've got to really emphasize, because you really want to make sure the muscles are stretched as far as possible and warmed up as far as possible. So the first thing you want to make sure, especially you want to make sure you're stretching the quadricep.
Right.
So
Let's check that out.
So to stretch the quadricep, there's a lot of ways to do it, but I like just the standing way, and you can grab the ankle, or if you can grab the foot by the opposite, but I just grab the ankle like this and I pull back like this, keeping good posture. And right here, if you want to add a little twist to it, you tilt your pelvis down.
Sure.
Can you show what tilt down means, Brad?
So it's going back this
Yeah.
way. And you'll find it, you'll feel it stretch right there more when you pull this knee back this way and keep your shoulder. Bob,
Yeah.
you got a little string on your shirt, what the heck? We can't have that on our video. Anyways, so here we go, we're going to stretch that out. You're going to get a good hip flexor stretch along with this and that quadricep. You can do this laying down too, which is a little more comfortable depending. And I kind of like doing this just because you can relax. I can relax more anyways. And again, it's like here,
stretched.
and then if you push up a little bit here, you'll get some more stretch. So it's just another option.
It's it's very important that you do that stretch. The hamstring stretch is important too. Where you can find a wall or something that's about this height.
Yeah.
Keeping good posture, just going to lean forward. That's about as far as I can go, Brad.
Knee straight. Don't
Yeah.
if you let the knee bend.
Yeah, that's
That's
not
cheating.
Yeah, it's cheating. So Good long stretch on both of those. And then you're gonna wanna start warming up the muscle slowly. You can start doing, by the way, one of the strengthening exercises we want you to do for the quadricep is what is called eccentric. And that's strengthening it while it's going lowering down basically.
Sure.
So what you're gonna do is you're gonna start off and you're gonna lower yourself onto a chair like this. And then you can go up with both legs. And then again, lower yourself onto a chair.
Okay.
It would even work better running in a lower chair because it would work better then.
Right. It'll be easier on here. If it's too painful to do this, then you should go on a higher surface.
I couldn't lower myself all the way down.
Yeah, if you're, you know, if you're 15, 20, or, 12, 15 years
Yeah, you
old,
probably can do
you're
that.
gonna be able to do this easier with better balance than us people over 50.
So, and then you can do, slow sidestepping, braiding, retroambulation, all these things very slowly to get the muscles warmed up.
Right.
And kind of some of that dynamic stretching.
Yeah, so you're gonna do these warm-ups before you get out to ready to do your full sprints or, whatever your activity is.
Okay, the other thing then, the third treatment for Osgood Schlatter category basically is how do you decrease the pain? So one thing after every event, after every athletic event, every practice, I want you to ice it. And a quick way to ice is to actually just take a styrofoam cup and fill it with water, put it in your freezer, and after it's frozen, you just tear off the top till you get down to the ice. And I usually put my hand on to smooth out the ice a little bit. And then you can just go ahead and put it on there and rub it until it gets numb. And that way, it's not gonna take that long to cool it down.
Right.
You can do it right on the bone.
Usually about 5 minutes.
5 minutes or less. But
Put a towel under your leg, otherwise you'll get a wet floor and your mom will get mad at you.
That's right. The other thing, you just throw an ice pack on and you can leave that on for 20 minutes.
Sure.
If you want to, so. Strapping, you wanna show the strap, Brad?
Sure. This is something you have to trial with and see how it works, but they're not real expensive. If it's not effective, it's not a big loss. This one, they call them a choke pad, but that's just a manufacturer. There's other companies that make it. It's kind of like a rope with inside the strap, so there's a bump there and a ridge, and you put that right above the bump over that tendon, that hollow spot below the kneecap and that bump, and then you just simply
Strap it pretty
strap
tight.
it, yep, strap it a little tight there and give that a whirl.
And the idea is that you're taking some of the stress off that bump. And now instead of the tendon pulling on the bump, it's pulling right here.
Right.
That's the idea.
Right,
Now, I think the effectiveness of this is questionable.
right.
But I would try it. It's worth a try. And you
Yeah.
can actually tape this way. There's a taping method even for doing
Sure.
this. But
It's, yeah, like I said, if it doesn't work, you're not out a lot of money. I've had people where they like,
yeah,
really
they like it.
so.
And if it even gives a little bit of relief, it may be worth trying.
Exactly.
Another issue you may want to consider to help decrease pain. Sometimes if you have flat feet, that will contribute to Osgood Schlatter, believe it or not. And the way it does is this bone gets turned when you have flat feet, and when this bone gets turned, it actually puts more stress on the tendon.
Right, so every time you put weight bearing through that leg, that bone will slightly rotate, and it does affect the stress on that.
So you may want to get some orthotics to help prevent the foot from flattening out. when you're on
Right,
your own.
some arch supports.
Yeah, which may help you in other reasons, anyway. But the final thing really is you have to understand that you do have a syndrome or a disease, and it's not going to go away until you're done growing. So you need to manage it, which means you manage it with rest at times. You may not be able to work out as much as you want, and you may not be able to even possibly your playing time may have to be decreased.
Right.
You just can't push through this.
Particularly things like if you want to do squats and
Yeah.
those things where you're lifting a lot of weight,
Yeah.
it's just going to irritate it, and you're not going to progress. It's probably actually going to make a major flare up.
You're gonna have to figure out how much you can work out and how much you can play and still keep the pain at a manageable level.
Right.
And that's only for you to discover, but
Right.
you need to understand that. So, good luck with it. I know it's a crappy thing, but I guess that's life, isn't it, Brad?
Right, and when you're young and you got this, you're probably feeling strong like bull everywhere else.
You wanna go, baby.
Yeah, so subscribe to us a little bit more often because we're gonna help you and your friends out take care of these issues that'll make you stronger and faster as life goes on.
Peace.